A rush to reopen. The nation's top infectious disease expert, Dr. Anthony Fauci, testified before a Senate committee that lifting restrictions too quickly could lead to another spike in cases. Joining us now is Dr. Rob Danoff, who's overseeing a testing site in Bucks County for Jefferson Health. Good morning, Dr. Rob.
Good morning. How are you, Jim?
Doing well. Hope you are as well. So you're on the front lines of this pandemic. Do you agree with Dr. Fauci about the rush to reopen?
You know, I think we have to have good systems in place. I mean, we do it slowly. The governor has our system in place. We've been social distancing. What we really need to have is, again, improved testing. We're getting better, but we still need to be better. But also train people to be contact tracers. Countries that are doing this well can identify people quickly who have this, and then identify people who've been in contact with them. And then if we quarantine or isolate them, it keeps it from spreading. So I guess I would say we should open slowly, but have our other systems in place, continue social distancing when we're outside, and definitely wear a face covering or a mask, and continue to monitor. I can't stress enough, testing and contact tracing, very important part of this plan.
So testing and contact tracing, as soon as they're ramped up to an acceptable level, that would be the right time to lift restrictions?
You know, I think so, with a caveat. We are seeing the numbers starting to go down in the hospitals and the critical care unit, but still not at the level in certain areas where it is as safe as in other areas. So I do think the plan, where there are less cases, where the hospitals are seeing less patients, is a good plan to open up slowly in those areas and then start to expand. But Jim, as you know, it's really important. There are a lot of people without income, having trouble finding food or affording food, even housing, to keep in their housing. They're worried about it. So putting in more social support during this time is also very important.
So, Dr. Rob, a new model is projecting possibly 147,000 COVID-19 deaths nationwide by August. So what are you seeing right now as far as your Bucks County site is concerned, as far as testing and results?
You know, we are seeing a lot of positive cases, close to 30% of those tested. Fortunately, most people do well. The big problem is in our independent living, but especially our nursing home facilities. That's where a lot of the cases are. The seniors are the most vulnerable, although this can affect anybody, our young people too. So it's getting better. The social distancing is working, and wearing facial protection, face covers, is really helpful. So again, the numbers are important. In our area, we are testing and we are social distancing, and this is part of a program that can help. So then when we open up slowly, it's going to be less people at our public places wearing face coverings. We are checking people, and that's the right approach.
You know, we've been talking a lot over the past few weeks about antibodies, and the other day I heard something that I didn't even realize. Is there a difference between short-term antibodies and long-term for this coronavirus?
Yes, there are. So there's something called IgM. That's basically the early sentry. These are the fast guards, the fast people in our body, these antibodies, that attack something first. And they're our early sentry. And then we have the longer-term antibodies. As our front lines start to decrease, we have these longer-term antibodies called IgG. They're the ones that stay in our body, and if this virus would ever come back to bother us, they attack them very quickly. So they continue to circulate. They have what's called memory. Someone comes in our body property, they're sentinels that they're going to go and take care of it as best as they can. So there are two types of antibodies, and we do look at them, and that's part of the test.
Well, Dr. Rob, useful information as always. Glad we're seeing you here, staying healthy and safe, and we look forward to speaking to you again in the future.
See you soon. Be safe, everybody.
Thanks, Dr. Rob.